So we're learning a lot more these days about the role dentistry can play in preventing migraine headaches. Even common dental issues like overbites can be corrected non-surgically in the dentist's office. Dr. Tigran from a Smiling Heart Dentistry is going to walk us through some of the options and how they make a difference in patients' lives. And he's joined by one of his patients, Lana Alexeyevitz. Good to have you both here. You want to start with things that are non-surgical, right? You want to work your way up and not leap to that.
That's right. We should start the most non-invasive ways, and then if the worst case scenario, we can go surgically.
But trying other things first. So let's talk about an underbite. You have a lot of patients who suffer from that. What is it?
So an underbite is something like this. Your
Bottom teeth are forward.
Lower jaw is more forward. And usually, many times it's because the upper jaw didn't grow enough. And so before, many times the only solution was to do surgical intervention and grow your upper jaw, move it forward, and cut the lower jaw and move it back.
Yikes.
Or one of those. Now we can actually, through revolutionary techniques, make a huge difference. You can see how her lip has grown forward, non-surgically. Even cheekbones grow forward.
How'd you do this?
This is through special stimulation of your upper jaw and the lower jaw. It actually grows about 1 millimeter a month.
How do you stimulate it?
With special appliances that is fixed through Facial Beauty Institute and Dr. Singh through DNA appliances.
Or is this what you use?
That's it, yes. And it's very predictable.
Isn't that something? Okay, let's talk about airway and sleeping issues. People have sleep apnea. Their partner certainly knows that they do because there's snoring involved. What can you do about that?
So same thing, when your jaws are small, your airway unfortunately becomes smaller because your tongue has no place but to be pushed back into your throat. And so when we stimulate your jaw to grow to its full potential, then your airway, like in this picture, you can see the volume of the airway has increased twice and the minimal area 3 times. Only within about 6 months.
And when you say you can stimulate the growth, does it have to be a young person, or can this happen at any stage of your life?
We usually start our treatment from 5 years old, and we can go to 90-some.
Wow. All right, tell me what this X-ray shows.
So the same picture without the numbers shows how much difference the airway has, how much the airway has increased by applying special myofunctional therapies and also stimulating the jaw to grow. So your throat has increased 3 times, by the minimum area has increased 3 times.
That is really something. Lana, you had, or have, I should say, migraines, because it's always a question of managing them. Before you went for this kind of treatment, what were you experiencing?
I was experiencing like ocular migraines with aura, which are very, very strong and painful. And a lot of times medication doesn't work if you don't take it in time. Also, I had a lot of tension headaches. And it's pretty amazing that something that could work that does not include any medication.
Right, because you'd probably tried a lot of different medications. How often were your migraines?
The migraines, about once a month, sometimes more often. But like other headaches, like tension headaches, almost every day.
Wow. So, Dr. Tigran, what did you do?
So in her case, we used a combination of techniques. We use a special orthotic that repositions her jaw, and actually by putting a special like temporary fillings, we changed how she bites. Once that was taken care of, you can see on the left side before her bite, her upper teeth were in front of her lower teeth, but her lower jaw wanted to come forward. So when we changed the bite, which was she's comfortable in this position, you can see the teeth are end to end. So in this case, the only way to have a normal bite is to surgically move the upper jaw forward or the lower jaw back. But we're going to do it non-surgically, grow her upper jaw forward after the migraines are gone, which is almost in a week after we started.
Wow.
And she had a tongue tie, which was already treated, but unfortunately she still had some tongue tie, and that's probably why she has this issue. Is her upper jaw was restricted from growing.
Ah, that makes sense. And so, do you have any appliance now?
I do.
And when will you be through with that?
So the second stage is about 6 months. I have it for about 2 weeks now. And within the first week before I got this appliance, I had the orthotic on my lower teeth. Within a week of adjustments, bite adjustments, my headaches completely went away.
Wow.
And actually to this day, it's already been almost 2 months and I haven't had a single headache.
That's amazing. Do you, can you feel the difference in terms of the jaw alignment?
I do, yes.
And does it feel more relaxed? How is it different?
It does feel more relaxed. I don't have, especially the tension headaches were mostly because I clench and grind my teeth.
Yeah.
But yes, so I stopped doing that and I don't clench or grind my teeth at night, my husband tells me. So it really did help me a lot.
Your partner can tell you a lot about what's going on
Yes.
with all of this. Is there a relationship between migraines and grinding your teeth, or if you just grind your teeth, what can you do about that?
The thing is, most of those things that we discussed, underbite, overbite, migraines, headaches, grinding, conversation, all of those things are connected to underdeveloped upper jaw usually. And so our treatment focuses on prevention. First of all, we recommend every single person born to be checked if they have a tongue tie, because that can cause prevention of stimulation of the upper jaw.
Yeah, that's a good thing for parents to know.
And then we also recommend to bring the children so we can check on them and give us the opportunity to help them grow normally, which is breathing through their nose. That's the most important thing that they can do for their kids. If the child is breathing through their mouth, it's almost guaranteed they're going to have sleep apnea, headaches, migraines, conversation, all of those things.
So let's jump on that before that happens. Kids often have a problem of overcrowded teeth. What do you do about that?
It's basically the same reason. If your jaw is too small, you're not gonna have enough space. So by applying those techniques, using special strips to make sure your child's nose is open. Before you can ask them to breathe through their nose, they have to have a patent nose.
Right.
So first things to do is open up the airway. If they have allergies or stuffy nose, a lot of times you can use nasal sprays like saline, which is salt water. You can use special stuffy nose strips, which will
Just
open
kind of
up your
open up your
nose.
nose?
This is probably one of the best ways to open up the nose.
And if you want to know what that feels like, just pull on your cheeks a little bit and you can see how that really works. And that then allows them to not breathe through their mouth.
Yes, and then another one is called breathe right strips, and that will stick on your nose. And I use a combination of those things for my kids, and I'm almost winning the battle with my son.
Excellent. Oh, good. I love hearing that it works.
He's only 3, so you got to start as soon as possible, because the sooner you start, the more potential you have to get 100% growth.
Well, and also you give them a chance to get used to it, right? It's hard to start that when kids are 12 or something. Yeah. Thank you so much. I'm very glad you're better, and it's very interesting to hear about this. For questions or to schedule a visit to see Dr. Tigran, you can find more online at smilesfromheart.com. And we'll have that for you on our website too. Coming up, a look at how food combinations can enhance weight loss and wellness after a quick break.